You most likely will be doing your exercises on a bed or a day bed. Some things you want to get in preparation to do your exercises are a garbage bag, a belt of some form, such as your house coat, either a coffee can, apple juice can, paint can, and if you can't find one of those, you can make your own roll from some towels. Starting today, after you've seen Nancy do the knee exercises, you are going to start to do your knee exercises 3 times a day, about 10 repetitions each. Start to do them on both legs in preparation for your surgery. You will continue the same exercises following your surgery. The first exercise, you will put your leg out nice and straight as you can get it, and it's moving your ankle up and down. So you're going to try and point your toes down like a ballerina, pull your toes up to your nose. The second exercise is trying to push the back of your knee down into the bed and hold for 5. So try and get the back of your knee as flat as you can, your legs nice and straight, and the muscle on the top is tight. Hold for 5. 1, 2, 3, 4, 5. Your next exercise, you're going to use your can. So remember that if you don't have a coffee can or a juice can, you can use your roll that you've made out of the towels. What you want to do is try and pull your toes to your nose and straighten that leg, but keep the back of your knee on the can. Once again, you're going to hold for 5 seconds. 1, 2, 3, 4, 5, and down. The next exercise is called a straight leg raise. So Nancy's leg is out as straight as you can get it. You pull your toes up towards your nose. You tighten your thigh, and you're going to lift your leg off the bed 6 to 8 inches. Hold for 5. 1, 2, 3, 4, 5, and down. The next exercise is where you need your garbage bag and your belt. So your garbage bag just helps make it nice and slippery. So you slide it underneath your leg. Your belt is going to go around your toes, and you're going to hold it with your handles. You can still lay back, and you're trying to straighten your leg right out, and you're trying to pull it up as far as you can. Hold for a few seconds and back out. Following your surgery, you are trying to get to 90 degrees, which is a little bit more. Bring it up a little bit more, Nancy. Bend, 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 bend. And there you go, about 90 degrees in the first 3 weeks following your surgery. And the last exercise is sitting in a chair or sitting over the edge of your bed. So to get out of the bed, Nancy is using her good leg underneath her operated leg to help her get it to the edge. So Nancy is trying to pull her foot back underneath her chair as far as she can go, and then slide it back out. To make the exercise a little more difficult, Nancy can try and pull her foot underneath the chair and then use her other leg to just give it a little nudge going back so you feel a little bit more of a stretch. Those are the 6 exercises you'll be doing following your surgery. Just a reminder that you're trying to do them 3 times a day, 10 repetitions each. You're going to do them on both legs because commonly after surgery, your good leg starts to take a little bit more stress. Before you start to walk, you want to take a few deep breaths because you may be dizzy when you first stand up. Your therapist in the hospital is going to put your walker in front of you. So we're going to bring her legs to the inside. After your head feels okay, you're not feeling dizzy, we're going to stand up with the walker. The way to measure a walker is when you're standing, I want to measure from your wrist crease to the ground. So I'm going to get Nancy to stand up. She's going to use her hands on the bed. Bring your good leg underneath her and stand up. And when Nancy is standing, the walker should be where she wears her watch. So you measure from the floor, the height from the floor to the handles. When Nancy starts to walk with the walker, she's going to put her hands on the grips. She's going to push the walker forward, move her operated leg in between, push with your arms and take a step. It's almost like the wedding march, those first few steps. It will take a few days before you become comfortable enough to alternate more freer. So when you're more comfortable, you can start to alternate so that your legs alternate and you're taking a space between the two steps. When you are ready to progress to your cane will be the same height as your walker. If you've had surgery on your right leg, you'll be holding your cane in your left hand. So we'll push up off the bed. When Nancy stands, we measure the cane the same way. Your hand goes down, should be where you wear your watch. When we walk with the cane, it will be the cane and your operated leg at the same time. So left hand, right leg, and at first you'll catch up to it, and then you'll start to alternate a little bit further so that your non-operated leg will step through. So when you're ready to progress to the stairs, on the way up the stairs, you will be using your good leg first. So your good leg, and then your operated leg and the cane come next. Good leg, then the cane and your operated leg. Good leg, cane and the operated leg. Good leg, cane and the operated leg. At the top of the stairs, you'll turn around and your cane will switch hands now and bring yourself closer to the railing. On the way down, it is your cane and your operated leg that come first, and then your good leg. Cane and the operated leg, and then your strong leg. Cane and the operated leg, and your strong leg. So when you do the stairs, it doesn't matter what side your railing is on. You're going to use your railing and your cane. On the way up, you'll be using your strong leg or your non-operated leg first. And on the way down, your cane and your operated leg will lead. Thank you for watching. Work hard, do your exercises, and we'll see you following your surgery.
If you have a standard height toilet, a raised toilet seat will help you get on and off the toilet easily. This one comes with arms. If you do not have room for arms, you can get one without arms. You need approximately 22 to 26 inches of clearance. Also, this just clamps on where you can tighten. Make sure it's solid before you sit on it. If you have just had a hip replaced, make sure that your hip is higher than your knee. Now this is a bathtub transfer bench. This bench makes getting into and out of the bathtub easy and safe. What you would do is walk up to your bathtub, go on the seat with your bottom first, slide in, and then swing your legs in. A handheld shower makes it easier to direct the water to you. So the bathtub transfer bench comes with the handle either on the left or the right side. So when you go to purchase or rent a bench, make sure you tell the vendor where your shower head is located in your bathtub. If you have a very small bathroom, if you have shower doors on your bathtub, or if you have a walk-in shower, a bath seat may be more appropriate for you. If you have a small space in your shower, then a bath seat without a back will fit. If you have more room And for the bathtub, a bath seat with a back. So as you lean back, there's less risk of falling.